recording after today. So welcome. I want to welcome everybody. Thank you for spending your time and thank you for being here. Okay, so here we are. Play and emotional symptoms that comes with PMS. So let me ask you this. Do you feel irritable or angry more easily, or sadness or depressed before your period? Okay, why this topic is so interesting for me. If you're just joining us, here's an introduction about myself. I am located in northern San Diego in a city in Carlsbad, which is about half a mile to a mile from the beach here. My clinic focuses on women's health, hormonal imbalance, chronic pain, and emotional stagnation. So this whole emotional stagnation is relates to anxiety, depression, sadness, or a host of other emotional stuff that we experience in our journey as a woman. So many women experience PMS before their period and think that it is normal. My goal here is to educate women on self-care and give them some tips and tools they can use to relieve these symptoms. It's very important to understand that these slides here do not replace the advice of your doctor if you have serious conditions going on, or substitute for any conventional medical service that you may need. So what is PMS? It is a group of physical and emotional signs and symptoms linked to a woman's cycle. It happens 5 to 10 days before your period. It disappears before or after your period starts, and symptoms may vary from woman to woman, but the pattern is predictable. The women have increased risk of PMS if you're over 30 years old, you have experienced significant amount of stress in life, in work, in family, you have poor nutritional habits, you drink too much alcohol, smoke, take drugs, or different combination of different things. You also suffer from side effects of birth control pills, have a difficult time maintaining a stable weight, not getting enough exercise. There's complicated pregnancy due to toxemia or preeclampsia. If you have had more children, the more severe the symptoms of PMS, and have a history of depression. So in Western medicine, the treatment in Western or allopathic medicine is diet and lifestyle changes. They also prescribe medication to manipulate the levels of progesterone or estrogen, which is the birth control pills. Also tranquilizers, antidepressants for symptoms related to anxiety and depression or mood swings. So prescription medicine brings relief, but they do not address the underlying cause of PMS. There are unwanted side effects that mimic PMS. Examples would be like mood swings, headache, depression, breast tenderness, inflammation of the bones and joints, and vagina candidiasis, and etc. In Chinese medicine, we find the root cause. So when qi and blood becomes imbalanced or blocked, we find an imbalance of this blockade of qi or vital energy, or there's a specific blood stagnation within a specific organ or channel system. Then the symptoms and signs of PMS will appear. So the role of the Chinese medicine or acupuncture is to investigate the causes linked to PMS. We evaluate, determine what organ and channel systems are out of balance, and we treat according to each person's imbalances and concerns. So this may reduce and relieve the symptoms and treat the root cause. So emotional symptoms before menses. Here are some of them: anxiety, depression, anger, irritation. It could be one, it could be both, it could be all of them, or mix. I want to bring the focus back on the uterus. Uterus has a broad definition in Chinese medicine because it encompasses structure beyond the uterus, including the fallopian tubes, the ovaries. In Chinese, is it called 宝藏 or 子包 or baby's bao or bao palace. Bao is a connotation of like a container, a palace, a place to honor and be revered because it's so sacred. It carries life, it gives life. So uterus in Chinese medicine definition is very important because of the function. How does uterus relate to the heart? There are 5 elements that we look at. So the heart pertains to fire, the fire element, and the kidney pertains to water. And these 3 organs are connected to each other. The uterus is functionally related to the kidneys via the uterus channel and to the heart via the uterus vessel. The later connection with the heart explains the strong influence of emotional stress on menstruation. So if any of this channel is blocked or stagnation happens between the heart to the uterus, uterus to the heart, uterus kidney, kidney to the heart, then imbalance will occur and PMS symptoms will be more. Next is the HPO axis. So in the science, menstrual cycle is a complex interplay of hypothalamus, pituitary and ovary axis. The axis corresponds to 2 main channels which runs from the vertical and front of the back body called the Ren and Tumai. So Ren and Tumai channel runs in a circle basically from the front and all the way to the back. And this channel originates from the kidney, pass through the ovaries, and the 2 channels go through the brain, which governs the hypothalamus, and both channels flow through the ovaries. So when this interplay has stagnation or qi stagnation or black stagnation, then it causes imbalance, causes emotional stagnation in the body. So by managing the Ren and Tu channel here, by clearing the stagnation, you will feel better. So do you have PMS symptoms consistently for 3 months? If you do, that means you need to take care of it. If you just have the symptoms once in a while, 1 month and then 2nd month, no, then it's not too much of a concern. But if you have these symptoms consistently for 3 months, then basically it just shows there's disharmony between the lung, the heart, the liver, the spleen, or the kidney organ. So how do we determine? We check the tongue color, we check the body of the tongue. Is it pale? Is it red? Or red on the sides? Does it have yellow coating? Is it slightly red on the side? So yellow means some flame, redness means some fire on the organ system. And we check the pulse. Is it choppy or weak on right hand or left or both sides? And that tells us different things too. So excess condition will be somebody who have more fire, if they have slightly red color on the side of the tongue and their pulse is a little bit more choppy. Deficiency symptoms, the pulse will be a little bit weaker and they have a little bit more of a pale colored tongue. So this tells us somebody who have deficiency symptoms mostly likely have experienced more of a sadness or the depression before the period starts. So here are some acupressure points to massage every day. It helps to soothe the qi, eliminate stagnation, and calm the mind. So you don't have to copy. I will have a PDF for these points here, acupressure points that you can use on yourself before your period starts when you're experiencing all these emotional symptoms. So some herbs to help you. Okay, St. John's wort are really good herbs if you have mild depression. If you are already taking antidepressant, then St. John's wort will not be helpful. And actually it clashes with the medication, so don't do that. Lavender oil as inhaler, diffuser. I also like rose oil. Also lemon to awaken the senses. Saffron is really good to add into food. It has a lot of anti-inflammatory. Ginseng, either American or Siberian ginseng, depending on your constitution. If you are prone to more anger, then take the American ginseng herbs or tea. If you are prone to more depression, then the Siberian ginseng will be better for you. Chamomile tea is also good to take. Of course, sunshine to help beat the blues, right? Sunshine 10 to 15 minutes a day to beat the blues. Others are like kava. These are South American herbs that helps to balance our mood as well. And of course, Chinese herbal therapy, depending on your constitution, your acupuncturist might prescribe different types. If you are more prone to anger, do reduce spicy or sour food. Try to avoid alcohol, caffeine, anything that will feed anger. Exercise, of course, that's helpful. Yoga, meditation, and some nice soothing bath. And just be aware that the awareness of these emotions, how you're feeling before PMS, are not your true self. So when you know, hey, you know what, I think I'm going to be starting my period in a week. I'm feeling kind of agitated. Just check in with yourself and say, hey, you know what, this is not me. These are my hormones. Let's take care of these symptoms right now. Okay, let's do some of these acupressure points. Let's take some of these herbal teas. Let's do some yoga or get some sunshine. Some self-help you can do. So these slides are for educational purpose only. These are not to prescribe or to diagnose any illness. If you have serious condition, please consult your physician. If you like more information on the acupressure point, for massage and self-care, you can download this on my blog. Here's the information. I will post this up in about an hour, so you will have this information. It will ask for your name and email just so that we know we can update you on the next live events or videos or self-care, things that we'll be uploading soon. So thank you very much. I hope this is helpful for you. I will post this link here at the end at the Facebook so that you can find the acupressure points with graphics and also how to do self-care yourself. Okay, so let's get back to where we are. All right. So hi again. Thank you for joining me. If you have questions, you can post on the website. I also have a focus group here for women's focus on women's health. That if you'd like to join, I'll be posting a few things as we go along. Hopefully you find this presentation helpful. Please share it with others, your sisters, your girlfriends, your aunts, anybody that you know who suffers from PMS symptoms that are emotional during their before their period, so that they can get some self-help. If you have any questions, I'd love to hear from you. I have my website and my blog also on the Facebook, so do feel free to drop me a line. Thank you so much, and I hope to see you soon. Bye now.